What is STD? Sexually transmitted diseases, STDs, are infectious diseases that are most often spread by sexual intercourse. STDs can be spread through various ways. It is wrong if you think you can only be infected through sexual intercourse. How do STDs spread? Have oral, vaginal, and/or anal sex with someone who has the infection. Have more than one sex partner, or have sex with someone who has had many partners. Don't use a condom when having sex. Direct skin-to-skin contact with the mouth, anus, or genitals. Sharing needles or syringes for drug use, ear piercing, tattooing, etc. How many people get STDs? Over 110 million people are living with STDs in the U.S. alone, as well as an estimated 400 million people worldwide. In the United States, about 19 million new infections are thought to occur each year. Almost half of new infections are among young people ages 15 to 24. 1 in 4 teenage American girls has an STD. How to prevent STDs? Don't have sex. Be faithful. Use condoms correctly when you have sex. Have a yearly pelvic exam. Most common types of STDs. HSV-1, herpes type 1, usually cold sore. HSV-1, herpes type 1, usually genital. HSV-2, herpes type 2, usually genital. HSV-2, herpes type 2, usually cold sore. HPV, human papillomavirus. HIV, human immunodeficiency virus. Hepatitis A, hepatitis B, hepatitis C, chlamydia, thrush, syphilis, gonorrhea, herpes, HSV-1 and HSV-2. Herpes simplex virus is known as herpes. The virus is categorized into 2 types of herpes. HSV-1 is usually oral herpes, and HSV-2 is usually genital herpes. There is no cure for the infection. Symptoms: a blister or multiple blisters on or around affected areas, inside the mouth, on the lips, around the lips, genitals, or rectum. HSV-1 causes sores around the mouth, inside the mouth, and on the lips. With HSV-2, the infected person may have cold sores or a rash around the genitals area. HPV, human papillomavirus. HPV vaccines are offered to males and females aged 26 and under who don't have HPV. The vaccine is a series of 3 shots given over a 6-month duration. Symptoms: often, people don't have any symptoms, and the HPV infection goes away on its own. Some types of HPV can lead to cervical cancer or cancer of the anus or penis. HIV, human immunodeficiency virus. HIV is a virus that attacks the immune system. When HIV progresses, it could cause AIDS, acquired immunodeficiency syndrome. Symptoms: symptoms may appear from a few days to several weeks after a person is first infected. The early symptoms usually go away within 2 to 3 weeks. After the early symptoms go away, an infected person may not have symptoms again for many years. After a certain point, symptoms reappear and then remain. These symptoms usually include swollen lymph nodes, extreme tiredness, weight loss, fever, night sweats. Hepatitis B. Hepatitis B is a serious disease caused by a virus, hepatitis B virus, HBV, that attacks the liver. It can cause lifelong infection, cirrhosis, scarring of the liver, liver cancer, liver failure, and death. Symptoms: jaundice, yellowing of the skin or whites of the eyes, and/or a brownish or orange tint to the urine. Unusually light-colored stool. Fever. Unexplained fatigue that persists for weeks or months. Gastrointestinal symptoms such as loss of appetite, nausea, and vomiting. Abdominal pain. Frequently, there will be no symptoms, and it is only discovered in a blood test. Often, symptoms occur 1 to 6 months after exposure. An estimated 30% of those infected do not show typical signs or symptoms. Hepatitis C. In the U.S., 3.2 million people have hepatitis C. Hepatitis C is a virus that could cause inflammation of the liver. Symptoms. The majority of individuals with hepatitis C don't experience any signs or symptoms of the virus. If liver damage occurs, the following symptoms may occur. Jaundice, a condition that causes yellow eyes and skin, as well as dark urine. Stomach pain. Loss of appetite. Nausea. Lethargic. Temperature. Chlamydia. Chlamydia is easily spread because it often causes no symptoms. About 75% of infections in women and 50% in men. It may be unknowingly passed to sexual partners. Symptoms. In women, abnormal vaginal discharge that may have an odor. Bleeding between periods. Painful periods. Abdominal pain with fever. Pain when having sex. Itching or burning in or around the vagina. Pain when urinating. In men, small amounts of clear or cloudy discharge from the tip of the penis. Painful urination. Burning and itching around the opening of the penis. Pain and swelling around the testicles. Thrush. Thrush is an infection of the mouth caused by the Candida fungus, also known as yeast. The overgrowth of Candida causes thrush. The infection could be spread by kissing or performing oral on an individual with this condition. Symptoms. A common sign of thrush is the presence of creamy white, slightly raised lesions in your mouth, tongue, or inner cheeks, but also sometimes on the roof of your mouth, gums, tonsils, or back of your throat. Pain or difficulty swallowing. A feeling that food gets stuck in the throat or mid-chest area. Fever if the infection spreads beyond the esophagus. Itching feeling around the area of infection. Syphilis. Syphilis is a highly contagious disease spread primarily by sexual activity, including oral and anal sex. The bacteria could spread by kissing or sexual intercourse. Symptoms. Syphilis infection occurs in 3 distinct stages. Early or primary syphilis. Sore could occur on the genitals, in or around the mouth somewhere between 10 to 90 days after exposure. Sores are only present where the virus entered the body. Develop one sore or a group of sores. Sores are round, hard, and painless. Secondary stage. Lasts 1 to 3 months. It begins within 6 weeks to 6 months after exposure. Sores could be found on the genitals, anus, or mouth. Copper penny rash. Discolored spots may occur at the origin of the infection. Rash on the soles of the feet or hands. Muscle cramps, headaches, and lack of energy may occur. Hair loss, swollen glands in the neck, and aching when swallowing could occur. Moist warts on the groin. White patches inside the mouth, swollen lymph glands, fever, and weight loss. These symptoms typically clear within a couple of months. Latent syphilis, tertiary syphilis. If the infection isn't treated, it may progress to a stage characterized by severe problems with the heart, brain, and nerves. If syphilis is treated during the early stages, it's usually cured without complications if antibiotics are taken. Paralysis, not able to move a particular body part. Memory loss or dementia. Deafness or hearing loss. Severe damage to vital organs, which may result in death. Gonorrhea, also called the clap or drip. The bacteria could spread to the throat, anus, penis, or vagina. Symptoms. Not all people infected with gonorrhea have symptoms, so knowing when to seek treatment can be tricky. When symptoms do occur, they are often within 2 to 10 days after exposure, but they can take up to 30 days to develop.